are you doing? So I decided to make a video because I noticed when I was posting my last video, I noticed that it was on November 14th, uh, 2013 when I posted that video saying that that would be the last video from this channel. And so I thought, well, that is interesting. So I decided to make a video to talk about the reasons why I decided to stop and the reasons why I changed my mind about it. So as you know, somebody sent a letter to my school, and as I said, we pretty much think we know who that person was, especially by the language that was used in the letter. But this person mentioned that I had started this video, this channel, to talk about my weight loss journey, and somehow in the middle I started talking about my life and how I was depressed, and that I was talking about things that were too private and that might not be good for somebody that was studying to become a psychologist. And at the time, you know, I was annoyed and I was concerned about my privacy and all, and mainly because of clients and patients, because you know, if somebody decides, you know, that I have treated before, decides to Google me or go on YouTube looking for bariatric surgery, they might come across me and then they would find me and maybe know a little bit more about my personal life that I would like them to know. So this was one thought that crossed my mind. And then, you know, and at that time, by November, I was probably about a year working with clients at that time. Now I have a little bit more experience, even like 2 years more of working with patients and as a therapist, and my mind changed a little bit. So I'm gonna share something, and it's like making sure that that is not a violation of a privacy, of confidentiality of anybody, and it isn't. So I worked at a crisis house for a year, and I worked with some very low functioning people, in the fact that there were a lot of people that they were they had severe mental illness, like schizophrenia, you know, bipolar 1 and 2, borderline, personality disorder, people that were really severely depressed and suicidal. And it was heartbreaking in many moments because I had to work with them, but it was so rewarding. I was so happy to be able to work with this population, and I realized from them that, you know, we learn from school, oh, don't disclose anything about your life, it's about the client, and I agree. I totally agree that when you're having a session with the client, it's about the client, it's not about yourself. But I always thought, and I had used this in therapy before, I talked to my supervisors about it and they didn't see anything wrong. The reason why I was disclosing information was to help them and normalize their lives. So if somebody was saying, you know, I remember a group that I was running, can't remember what the group was on, and there was one of the clients at the crisis house that he said something along the lines, I can't remember exactly what he said, but along the lines like, it was easier for me to understand whatever I was teaching or to have more control of my emotions because of the fact that I was going to school and I was a counselor, a therapist, and who was he? So I might not be qualified or know exactly what they were feeling. And I told him, no, that is unfortunately not true. You know, so I normalized to the patient, say, no, you know, I'm a human. I'm human and I have emotions. We have doubts sometimes. We have anxiety sometimes about some things, and You know, there's sadness and there's grief and depression, and I'm not ashamed of any of that. You know, I think because I was depressed for a while, because I felt so low in some moments of my life, this helps me understand what the people are going through. So when they tell me how much that depression hurts, that the pain is so hard, I understand. I understand why for some of them it's so hard for them to even, you know, want to go out of bed. And I relate to them. I feel their pain many times. And that's probably because of my personality, because of the experiences I had in my life, because of whatever reasons. But I realized, you know, it's okay to be able to share some things, because one of the reasons why I have this channel is, one, uh, to help me, you know, move on with with uh, find strength and support from you guys. And even, you know, that's why I'm becoming a psychologist. When you speak, when you talk, when you hear the thoughts you're having, that's what you do in therapy. You talk, right? And then you get the feedback from your therapist, and trying to, you know, understand what you're saying, trying to redirect you when you're maybe creating framing those thoughts and feelings in a way that's not healthy for you. That's basically what the therapist will do. Um, so being able to be here and talking to you guys and making these videos help me be more accountable for my life. And so it's really helpful. But it also, I think it's helpful for somebody else that is looking for help, because I know that when I was researching, you know, trying to find information to understand what the bariatric surgeries were, what the patients go through, if there's something that I needed to know, YouTube is an awesome resource. I have seen therapists that I admire that have their channels, and they talk about different sorts of, you know, things about psychology. So I thought, well, maybe I can be a resource for somebody. Maybe my experience can help somebody else. And, you know, and if that's the case, I will do my best to try and help uh, other people. So I will continue this channel for as long as I can. I know that my life is not probably, but it might get in the way at some point with internship or dissertation or whatever it is, and I might have to be absent for a while or not. I might restructure this channel at some point, but I think that it is like, I wouldn't say a mission, that's not a word, this is like thinking it's too big of a thing, but it is my path in life, I guess, to help people. I have a passion for it. I have a passion for helping the underdog, helping minorities, helping people who feel like have low self-esteem, feel that they don't have a lot of chances in life. My heart just goes towards those people. And I had a client, one of my last days at my last practicum site, and she asked me, "Oh, can I work with you tomorrow?" And I said, "Well, I won't be here tomorrow, and I'm leaving." And, you know, she was thanking me, and she said, "You empower women. I really enjoy working with you." And that touched my heart so much, you know, because that's exactly what I want to do. I want to empower women. I want to empower people. I want to acknowledge, you know, I have learned a lot of things uh, these years, and I want to empower people, and I want people to understand many times that we have life is hard, you know. uh, those stressful things are going to continue to happen. And I think one of the worst mistakes that we can do, and I know that I made a video about this one time about the pursuit of happiness. I'm against it after I've learned a lot of things. Like, happiness is not a it is not a natural state. It's one of them. Life is stressful. You know, it's the way you react to it. It's what makes the change. It makes the difference. Um, so yes, I want to help people to understand that they don't have to make big expectations about life. That life is it is hard. Life gets complicated. And what I want to do is be able to help people live through these moments and realize it's okay to be upset. It's okay to be depressed. It is okay to gain weight. It is okay to not be perfect. And we should not strive to say, oh, it's okay, I'm going to be here. That's not what I'm saying at all. What I'm trying to say is it is okay that these things happen in your life, and you don't have to let these things bring you down to a point where you are immobilized and you can't do anything. It is okay to say, well, you have to accept things in life, and then when you accept some things in life, that things are hard, it's easier for you to move on, you know, and try to find different ways to achieve goals and make changes in your life. Sometimes it's not the change that you want. So, you know, adapt to the conditions of life, basically. So that's what I was trying to make this video about, is to let you guys know that I will continue having maybe different videos. I don't like to mix them up. Like, one video is going to be about weight loss and my journey. Some other videos are going to be about different things. And I hope that whatever knowledge that I had acquired throughout my years in my life, that I'll be able, even if it's one person, with whatever I can share with my experience, I could help somebody. And again, I want to make clear and clear and clear, I am not saying any of these things thinking that I'm in the capacity of a psychologist. First of all, I'm not a psychologist yet. I'm not claiming that I have the answers for everything. I am not saying that I'm an expert at anything. What I am saying is that I have my own life experience. I have learned from my life, and I know that the things that I have learned in my life had helped me become a better human being, and see life from a different perspective, and which is helping me have a better experience as in life, you know. So if I could share this with anybody, I will be really happy. If anybody wants to talk to me, I'm fine. I will not talk to anybody in the capacity of a therapist. I'm offering my friendship for anybody that needs it. And as a friend that I would maybe give my opinion, I might give my opinion to you, but at any moment at all, I am claiming that I am a psychologist, that I'm an expert at anything, or that I will do therapy with you or for you. No, this is not the purpose of this channel. This is a purpose of a channel where I want to have this open communication with everybody. And if somebody has a question about something that I might have some knowledge, and I could read books or go take a look at some articles and stuff like that, or even from my own life experience, I'm more than happy to share and help you out. All right, so that's about that, and I'm happy to be back. Sometimes I just have a lot of things in my mind, and I'm like, oh, I want to share with them, but I don't have time. So I will probably be posting more little videos here and there to help me out and help you guys out. Okay, so I'm looking forward to seeing you soon. All right, talk to you later. Bye.